My dear viewers, we have Dr. Sridevi with us. Today, let's learn the fluid less in pregnancy. They call oligohydramnios. Can you share, doctor?
Thank you. So normally there should be at least 1 liter of fluid during pregnancy around 36 weeks. It increases, like in the beginning that will be less, and around 36 weeks it starts increasing. But what happens in oligohydramnios means the amount of fluid is less. So fluid is less than 1 liter, and when we do it in an ultrasound, the AFI, that is the amniotic fluid index, where we measure in force, we divide the abdomen into 4, and the total of the 4, the amount of fluid when it's less than 5 centimeters, or in a single pocket, that is in a single quadrant when it's less than 2 centimeters, we call that as oligohydramnios. So what are the causes of oligohydramnios? That is when the production is less. So when the production is less is basically because of uteroplacental insufficiency. Because as we already know, the fetal urine is what is the amniotic fluid. So when the uteroplacental insufficiency, that is there is some problem between the blood flow between the uterus and the placenta to the baby. So these kind of conditions, for example, in pregnancy induced hypertension or in antepartum hemorrhage. So these kind of conditions where the blood flow is less, then they have a reduced LICA. So when they have a reduced LICA, what happens is the baby's growth also reduces. So in intrauterine growth restriction, there also they have the reduced LICA. Some problems in the baby, for example, the urinary tract of the baby is not well developed, or there is some constriction, it cannot pass urine properly. So those kind of anomalies in the baby also can cause oligohydramnios. As we said, from 36 weeks, what happens is again the fluid starts decreasing. So for example, 37 weeks to 40 weeks is term, but even after 40 weeks still you have not delivered, then the fluid starts decreasing. We call that as postdatism or post-maturity. In post-term pregnancy, again the fluid starts becoming less. And another important condition is when there is uteroplacental insufficiency. That means the blood flow to the baby is not fine. There may be fetal distress. So when there is fetal distress also, when there is fluid less, there is fetal distress. So indirectly again there also the fluid will be less. So these are some causes for a decreased fluid. So if there is decreased fluid, what happens is the baby is not able to move adequately, since it's the amniotic fluid is needed for the movement. So what happens? Some babies may have some problem in the leg. We call that as club foot. What happens is musculoskeletally, for a prolonged time when the LICA is less, they are in the same position, they are not able to move around. So that's club foot. And since this amniotic fluid is very, very important for the lungs, for the surfactant to be produced, so the lungs don't develop adequately. We call that as pulmonary hypoplasia. That means the baby's lungs are not developed adequately. If it is, when you diagnose oligohydramnios, what do you basically see? How do you diagnose? Is by ultrasound. So when you, and also by clinical examination, it will be lesser. Normally, if it has to be 5 months, it will be lesser than the period of gestation. So what do you have to do at that point of time? Depending on the period of gestation, because we want the baby to be very carefully monitored. We have to monitor the fetal heart rate, the fetal tone, that we call it as NST. So the baby's heartbeat has to be monitored, whether it's going for any distress, we want to know. And depending on that, whether we have to deliver. And also something called amnio infusion can be done, but that is done in the initial stages of labor, because we need the membrane to be ruptured. We cannot rupture the membrane much earlier. So when the membrane is ruptured, then we give fluid so that we can facilitate normal delivery. Because of this oligohydramnios, when sometimes you will have to deliver the baby earlier, and also there's a more higher chance of cesarean section also.
Okay, doctor. Okay, thank you very much. Thank you for learning. Thank you.
Thank you.